Well, please allow me to present the next speaker. And the next speaker is me. I'm Leandro Fernandez from Caracas, Venezuela, director of the Laboratory of Advanced Sonography in La Floresta Medical Institute. I am also director of the Sonoimagen Global Ultrasound Academy, where we teach physics and Doppler applications. Currently, I am the vice president, of the World Federation for Ultrasound in Medicine and Biology, and co-chairman of the Education Committee. So I'm really very, very pleased to have you all here. And now I will present POCUS in DVT, point of care ultrasound in DVT of lower limbs. And after the presentation, we will come back live and we will answer all your questions. Hello, everybody. I am Leandro Fernandez from Caracas, Venezuela, and I will discuss on the topic POCUS in deep vein thrombosis in lower limbs. Let's start our lecture. First of all, I would like to start by defining what point of care ultrasound is, POCUS. So it is defined as ultrasound performed at the bedside or where the patient is to answer specific clinical questions to guide the treatment or conduct to be followed. It is a targeted and focused exam. And also it is a binary exam. There is or there is not a given pathology. It is a positive or negative study. In our case, there is a DVT, deep vein thrombosis, or there is not. Currently, ultrasound is the method of choice for venous study of lower limbs. Let's begin with the POCUS study protocol. Which is the minimum equipment necessary to make this kind of assessment? Well, with the current technology, of course, we will prefer a digital system, but we can use also an analogical system. But it's necessary to have high resolution. And how we can obtain high resolution? By using a linear probe with 10 or more megahertz. We need at least 128 channels. And we can use different types of ultrasound systems. We can use a car-based, a portable, or even an ultra-portable system, as this one there you can see on the picture. In this case, one side of the system is a linear probe, the other side is a convex probe. And this kind of equipment make a communication by using a Wi-Fi intranet with our cellular phone, smartphone, or tablet, but also can be used this kind of systems that you are seeing here in this slide. This is the car-based, the regular one that we have in our labs. We can take it to the emergency room or we can take it to the hospitalization area and perform a POCUS assessment. This is a very interesting machine because it's a multi-purpose machine. It changes automatically by using artificial intelligence software, depending on the preset that you can choose. It has 19, 20 presets, different presets, and it changes itself from linear to convex or to phase array. If we want to do a cardiac or we want to do a vein study. So this is wired and you can connect it to your smartphone or to your tablet too. Those are types of tablet, different types of tablet. You choose the transducer linear in our case for DVT. And as I said, we can use our regular machine that we have in the radiology department of the ultrasound department. Regarding the position for a DVT scanning, we can perform this study with the patient in supine position. The patient can lay down. And notice the rotation here of the thigh with the flexion here of the calf. This is to better access to the region that we want to study, the anatomical regions that we want to study. So patient can be in supine position. Different to the studies, the venous studies for the valvular system, that we need that the patient maintain the position, the stand-up position. And here, that's the way we start our studies. We have to look for Mickey Mouse. Mickey Mouse is a very well-known character all around the world. So this is the Mickey Mouse's face. And here we have the Mickey Mouse shape. And here we have the Mickey Mouse in ultrasound. We have to identify and recognize the different anatomical structures. We will see it in the next slide. We place the transducer in the inguinal region, and we, doing the proper angulation, we can find this Mickey Mouse shape. Let's see this video. We are doing compressive maneuver. The compressive maneuver, the idea is by pressing with the transducer on the area, over the area, we want to collapse the walls of this structure, of this Mickey Mouse shape. Compression. In this second part of the video clip, we have the leg, the left leg. We place the transducer on the inguinal area. And here we can get the vascular elements. I mentioned that we have to recognize the anatomical structures. We have a face and 2 ears. This ear here corresponds to the common femoral artery, here common femoral vein, and here the confluence, the saphenous femoral confluence. We have to look for the interior of these structures. The normal is any kind of echogenicity inside, and then we do the compression, and we can collapse the walls of the different veins. Let's mention some additional information regarding the compressive ultrasound, CUS protocol. We have to compress every 2 centimeters from proximal to distal. Usually from proximal, but some sonographists do it from distal to proximal. But most of the centers, most of the sonographists and sonographers, they perform the test from proximal to distal. In our lab in Caracas, Venezuela, we do it also from proximal to distal. Depending on the country, depending of your guidelines in your labs, normally we can study only the symptomatic leg, mainly in the United States, USA. But in some countries of Europe and Latin America, in our country, in our lab, we study both legs. We make the assessment of both legs. But in many of the labs all around the world, they focused on the symptomatic leg. Here in this picture, we can see where we have to place the probe, starting in the inguinal region and then going to the middle portion of the thigh and finally to the popliteal. But it depends also in the regulations or in the protocols that you can have in your labs. At the beginning, we only studied 2 points, 2 regions, one here in the inguinal and the second point or region to study here in the popliteal area. But more recently, the recommendation is to perform 3 points. We will see the different kind of recommendations that we have for the place and how many regions or points we have to study. The whole leg compressive ultrasound may exclude proximal and distal DVT in a single assessment. Symptomatic patients, attention, symptomatic patients with initial compressive ultrasound negative could require a control in 5 to 7 days if no reason, no clinical reason was discovered to explain the symptoms referred by the patient. This is because although we have a higher specificity and a high negative predictive value, we need to offer to the physician who is treating this patient the reason, the cause, the etiology of the problem. But if we have compressive ultrasound negative, we can exclude in most of the cases the possibility of the deep vein thrombosis. This is exceptional, that to repeat the study in 5 to 7 days. Let's continue. Well, I mentioned that in the past, in many centers, almost all the centers were using 2 points or 2 regions, inguinal regions and popliteal regions, in order to make the assessment of TVT. But more recently, in many labs, they are using 3 regions. In our lab is one of those for POCUS. 3 regions: inguinal, middle portion of the thigh, and popliteal region. With 3 regions, we can better study the femoral popliteal segment. But now we have also recommendation to make this study extended up the tibial, peroneal, and muscular vein confluences. So it offers a more complete area of visualization. And also another authors suggest that we need to do a complete assessment of the leg from the inguinal region to the ankle. But most of the countries accept very well the 2 and the 3 regions. I prefer the 3 regions to make the POCUS protocol. Let's see this picture taken from a paper published by Larry Needleman in Circulation in 2018. Here we have a very schematic depiction of the veins of the leg, the common femoral vein. Here the grade or the magna is better called magna saphenous vein, the femoral vein, popliteal vein, and here we have the confluences for the muscular veins of the peroneal veins and the posterior tibial vein. And here, that's the area that we can study with the protocol of 2 regions. So we can study the inguinal in order to determine if we have a thrombus inside the common femoral vein. And then we jump directly to the popliteal region in order to study the popliteal vein. But if we do 3 points, we are doing almost an extended compressive ultrasound from the inguinal, middle thigh, and here the popliteal veins. Another recommendation is to make a color compressive ultrasound in B mode and use the color. And with color, you can study all the path, all the way down of the femoral and popliteal and the confluences. And another proposal is to do a complete study with color, with Doppler, pulse Doppler, and compressive ultrasound in the whole leg. But if we want to maintain our study, our assessment with the POCUS protocol, we can do it perfectly with 3 points, better 3 points, even 2 points, but better 3 points. And it's not necessary to use color Doppler for that. Just please do the compressive maneuver and you will be accurate in your diagnostic if there is or there is not a DVT. If you find this expression, 4-point focus ultrasound, it refers 4 points to 2 points in one leg and 2 points in the other leg. So these people with 4 points are studying both lower limbs. I mentioned that in some countries, they only performed the study in one leg. So let's see another example with B-mode, compression maneuver. Mickey Mouse, we are performing the maneuver. At the beginning, I think that we did very strong. I collapsed the artery, but in the second maneuver, the second chance was more gentle, and we collapsed only the veins, the confluence and the common femoral vein, and this is the artery, common femoral artery. So we have no images inside. We have no echogenicity images, echogenic images inside, and we can collapse the walls. So this is a negative focus maneuver. Another example, we can collapse the walls, confluence here, one ear here, and another here, the face. Again, now we have here all the structure. We can see, or you can see, I'm sorry, if you go to the WFUMB website, WFUMB.info, you will find an excellent ebook on ultrasound. You can see it and you can have it for free. The lecture mode is online, and you go there, and we have 29 chapters, different chapters, and you can see these videos in this chapter written by this author, myself, with in cooperation or collaboration with Dr. Michael Kawuya from Uganda. In this case, we are observing low echogenicity inside the confluence, the saphenous femoral confluence. And here, when we perform the compression, we can collapse the walls of the common femoral vein, but the confluence cannot be compressed because it has a thrombus inside. Attention, don't be so strong, don't be so rude in the moment of performing this maneuver, because sometimes it is described on the literature that it is possible to make a fracture of this thrombus and cause an embolism for these patients. So if you see the structures, do please a gentle compression in order to confirm that the walls cannot be collapsed. It is possible to estimate the age of the thrombus according to the characterization of the echogenicity. Yes, the answer is yes. So we have those characteristics here corresponding to a recent thrombus. So the thrombus can be anechoic or hypoechoic or hypoechogenic. Both words are okay, are correct. The thrombus is homogeneous. It's poorly adherable. Thrombus floats. It's floating. It's a floating thrombus. The edges are smooth. The thrombus is fluffy and deformable. And the vein in a recent thrombus is dilated and painful. This is very characteristic, dilated and painful. An old thrombus is not anechoic or hypoechoic. Now the thrombus is hyperechoic. It's heterogeneous. It is adhered. It's firm. It means that it's firm. The edges are irregular. The thrombus is rigid and not very deformable. And the vein that when recent was dilated, now the vein is contracted. And the vein is not painful, another characteristic. So we can estimate the age of the thrombus in a differentiation of recent and old thrombus. Let's see an image of corresponding to a recent thrombus. This is the confluence, saphenofemoral confluence. We have some areas anechoics. We have here low or medium echogenicity, low echogenicity, medium echogenicity, and mainly anechoic areas. This is a recent thrombus. Here another recent thrombus in a muscular vein, gastrocnemius, in the calf. And here is more homogeneous. Look at the shape, look at the borders. It's occluding partially the vein, which is dilated. This is even more recent. Very, very smooth, painful. And attention, be gentle when you do the compressive maneuver in these cases. Be gentle. This is an old thrombus, the popliteal vein with medium echogenicity, high echogenicity inside. And we have here two muscular veins. One is okay, one is patent. We are seeing here color Doppler. We are using color in this case. We used color in this case. But look inside the another muscular vein is occluded, is occupied with this medium echogenicity, with some parts with higher echogenicity in the interior, with negative Doppler signal. And of course, the compressive maneuver was positive. It was impossible to compress those vessels. So recent and an old thrombus. Attention in these cases. We are seeing here this video. It's almost real time. And here we are seeing some kind of movement inside these dilated muscular veins. But if we do compression, let's see, the vessels can be compressed. Very easy. So the echoes disappeared. But again, when we release the pressure, they again are occupied by a very, very slow flow. Slow flow. This is not a thrombus. This is slow flow. So venous ultrasound has some disadvantages. It's operator dependent. We can have a decreased sensitivity and specificity in cases of edema of the lower limbs, in cases of lipodermal sclerosis, obesity, or in cases of immobilization. For example, cast or surgical material in fractured patients. But it has very good advantages. It is accessible, portable, available, painless, with no risk or side effects because it has no radiation. And message to go is the first choice method for the assessment of patients with deep vein thrombosis. And finally, my dear friends, thank you so much for your kind attention.